Well, let's now head to Botswana, where African medical experts, ministers and other stakeholders in the health sector are meeting with their Chinese counterparts at a conference aimed at improving cooperation in providing healthcare across Africa. Delegates at the conference, which opened Monday, will discuss new ways of tackling malaria, HIV and AIDS, as well as improving access to affordable drugs in Africa. CCTV's reporter Penina Karibe is in the capital, Gaborone, and joins us live. Penina, it is the first day of the conference. What can you say is topping the agenda?
Well, Beatrice, it is indeed the first day of this for International Roundtable Forum, and it's been a very busy day, I can tell you that, Beatrice. Now, 3 issues took center stage today. First, just as the name suggests, this was the 4th International Roundtable on China-Africa Health Cooperation. And so stakeholders here were discussing how to further promote this cooperation, with the African players saying that they've been looking up to China to sort of get solutions and get lessons up to on how they can improve the sector. Now, they were saying that just a few decades ago, they weren't the same level as China. China has instituted reforms in the health sector that have gone a very long way in improving the health sector. And so these were some of the issues that the stakeholders here were looking up to, what lessons they can draw from that. Now, the second issue, Beatrice, and I'm sorry, just to take you back to that, we had from the Chinese representative saying that they've been involved for about 50 years now in efforts to try and come up with solutions to various challenges plaguing Africa's health sector, and they say that they will continue to put in more efforts, notably setting up research institutions here in Africa and enhancing capacity by training medical personnel from Africa. The second issue, Beatrice, that was discussed today was what they were calling key challenging areas when it comes to the health sector. Now, they pointed out HIV, just like you mentioned there in your intro. They talked about malaria, they talked about reproductive health. Now, talking about HIV, we heard from the African Union representative who said that this is a disease that has severely affected Africa's economy and development. He said that a great majority of Africa's workforce has actually fallen to the AIDS pandemic. And so basically it was a stock-taking session. What have they achieved since 2009 when this international roundtable was commenced in Beijing? So, and why they have not achieved what is left and what they can do to achieve it. Now, there will be a follow-up meeting in Beijing in August, and health ministers from Africa are widely expected to attend amongst other stakeholders. And finally, Beatrice, the third issue had to do with international organizations. How can they support this cooperation between China and Africa in terms of health? Now, we've had very many international organizations here, such as the World Health Organization, we have DFID, UN AIDS. And so what we were getting from this session today is how these players can offer quality services, talking about affordable quality drugs, perhaps data through setting up of research institutions in Africa, and even funding, Beatrice, because this is another issue the African Union was saying has significantly hampered a development of various objectives set out in previous such sessions. So really they're saying they're expecting to find more solutions at least by the end of these 2 days session here.
All right, Penina Karibe joining us there from the Botswana capital, Gaborone. Thank you very much indeed for your update.